Okay. All right, well, we'll go ahead and get started. Hi, everyone. My name is Karen Venus. I'm the CEO at Sayre Christian Village, and I've got somewhat of a script to follow, so I keep it to an hour because I like to talk. So what I'm going to do, just some housekeeping items. I've muted everybody's line for right now because we do have so many folks on the call. We have received a lot of questions ahead of time, so I want to make sure that we cover all the information that was submitted, and then later on in the call, we'll unmute and give everybody the opportunity to answer any questions that we did not cover. So that being said, I appreciate you joining me today to talk about specifically what's been going on with COVID testing here at the Healthcare Center. I know that if you're receiving my one-call notifications and text messages, sometimes the information we're sharing can be confusing, but our goal is to be as transparent as possible and get the information out to you in the quickest manner possible. So hopefully after today's call, you'll have a better understanding of some of the terminology that we're using and really just the how, why, and when, and what goes on behind the scenes when we do a round of mass testing and the reason for doing it here on our campus. As you may know, we have conducted 4 rounds of testing at this point. And currently, as we speak today, we're actually underway the 5th round, and I'll explain all of that here in just a moment. So as I said, everybody will be muted for the time being, and then we'll open it up for questions that we don't cover later on. Before we get started, I would like to introduce our special guest for today, Mr. Adam Mather, and he's on here somewhere. I just saw his face. But Adam is our Inspector General for the Commonwealth of Kentucky, and he is fairly new to his role. I'm sure when he was appointed Inspector General, he didn't realize that about 3 months later he would be dealing with COVID. I don't think any of us were in that position. But just a little bit about what the Office of Inspector General is, for those of you that may not know. The OIG is the regulatory and licensing agency for all healthcare, daycare, long-term care facilities, and child adoption, child placing agencies in the Commonwealth. So he covers a lot more ground than just long-term care facilities. Mr. Mather holds a Bachelor of Science in Nursing from Georgia State University, and he's currently pursuing a Master of Health Administration at Cornell University. His experience as a nurse, as well as his previous experience working in long-term care, I think makes him a great candidate for his job, and Adam and I have had the pleasure to work together on a couple of other things since his appointment. And as you all know, I'm fairly new to my role too. So it's been a pleasure to get to know him. And I guess one of the things that's most exciting for me is I feel like we're at the point where we are changing the conversation about long-term care in a positive way. And his office and his team have done a remarkable job in being great advocates for what we do, but at the same time, upholding their regulatory responsibilities as well. So according to the Cabinet for Health and Family Services website, there are over 300 long-term care facilities in the state of Kentucky that Mr. Mather and his team are responsible for regulating. And as you can imagine, you hear right now, specifically with COVID, what is happening in long-term care facilities. So I'm going to guess he's not working a normal day as we aren't either here on our campus, but I just appreciate him carving just a few minutes out of his time today. I know he's got a very busy schedule. He won't be able to stay the whole time, but I want to ask him some questions first that have come in and just explain, just the rationale behind some of the things that are going on with COVID and in long-term care. So that being said, you ready, Mr. Mather?
I'm ready. Can you hear me okay?
I can. Thank
Perfect.
you. Can you first just start by explaining, there's lots of words and lingo going around at the moment. Can you help our participants understand what is these focused infection control surveys or targeted infection control surveys as it relates to COVID?
Sure. So as the pandemic started spreading across the country, CMS, who we are contracted by to do our annual surveys, complaint surveys, came out with what they call a focused infection control survey. and it really touches all the key points about infection control, hand washing, hand hygiene, proper use of PPE, having the supplies of PPE, all of those things. And so they condensed it onto a survey form. All the long-term care providers were given the form as well so that they could be compliant with it. And what we do is we go in for our normal survey activity was suspended. And so we'll go in, we'll go in for the day and go through that program. And I think we've only had a couple facilities actually get deficiencies. Now it's quite a different process than your standard survey, and we are only there for a day. And so, we are only allowed to cite for things that we actually are there and can see. So it is a different process, but I think there had to be some sort of change, given that we can't send surveyors in for 5 days at a time anymore, and they don't have as free access as they once had to kind of roam the halls. So I think it was a good option for CMS to put that in place, because otherwise we would have suspended surveys completely. So I think it was kind of a happy medium.
Great. Well, at Sayre Healthcare Center, we actually have had 2 targeted infection control surveys. And the purpose of those, from where we see it, is to make sure that we are turning over every stone to make sure that we, from an infection control standpoint, do everything we can to prevent and mitigate COVID here at the healthcare center. So, and we didn't receive any deficiencies in those surveys. So that was a good thing. But I know that's a question that a lot of folks have, and I know you're probably, if we're getting too far down in the weeds, CMS is Centers for Medicare and Medicaid Services. They're our regulatory agency. They're the big folks that we speak to. So. All right, tell me about what's going on in testing in long-term care facilities. In particular, this we've heard it called initial, we've heard it called baseline testing, we've heard it called surveillance testing. What is that looking like for all facilities in long-term care at the moment?
Yeah, so we should be wrapping that up mid of next month. So we actually have 286 licensed facilities, and so we have added some additional ones as they popped up, whether they're assisted living or personal care facilities. If they had issues, we brought them into the testing. So that's where we go in and test the entire population, resident population, as well as all staff. And so what we found is, one of the things we did early on, which I think, I hate to say it to you guys because I know it certainly was a painful experience, but we stopped visitation. And so with that, we were trying to limit the vectors that were coming into the facility. And unfortunately, you can't stop staff from coming in because that's your front line, and they're there to take care of your family members. And so typically what we've seen as we've gone in and we've found 1 or 2 patients, it's usually they either came from a acute setting to the facility and had it before they entered the facility, or staff have brought it in. And you can only mitigate so much risk, and it's a highly contagious virus, as you've seen in not only the state, but nationally. I think as a state, we've done very well comparatively. But so we are, I think, moving along. It's a very comprehensive process. It's actually going to be the standard practice, I think, going forward. QIO, which is a quality initiative organization that works with CMS, has said that it's one of the best practices that they've seen of any state. So there's a partnership with Norton Healthcare. They go in with our HAI team, which is Healthcare Acquired Infections team, and do a preliminary discussion with the facility, talk about any barriers or issues they're having. And then after that, we'll either do testing on site with them, or they do it on their own, and then we go over the results and any action plans that need to happen. We've sent in some, at times, additional staff if needed, PPE, whatever resources were needed to kind of help them through.
So looks like you said earlier that we're close to finishing up that initial round of testing for long-term care facilities in the state. And it looks like as of Thursday, there was about 210 that tested, that had gone through that testing process. And according to Leading Age, about 24% of those had 100% negative tests. Are you seeing pretty much with what you're seeing? Are you seeing it's primarily residents, staff, all over the board? I mean, it looks like if 76% of these facilities have at least one case in their surveillance testing, kind of what are you seeing on your end?
Yeah, so it's all over the board. I think, what's surprising to certain individuals is, you look at the 5-star ratings, and that really doesn't play into account the pervasiveness of the virus. So we've had some facilities that have been deficiency-free and 5-star facilities for years that we've had to do evacuations on. So, it's just a really unfortunate virus. Certainly easy to get. I think even with the best infection control techniques, there's still the possibility it just lingers. So, you could touch a door handle and 45 minutes later somebody else touches it and the virus is still active, and you don't even realize they touched it. So it's been all over the board. I think we've had larger companies that have had facilities with quite a few, and they've also had facilities that test the whole house tested negative. So there's really unfortunately no rhyme or reason.
So assuming you go through your initial round of testing and you let's say the whole house is negative, that's a blessing if that is the case. What recommendations are you seeing, or why would it be necessary to do any additional testing, or when would that take place? I guess what would have to happen in a facility to have additional testing before CMS comes out with whatever that looks like down the road?
Yeah, so they've left it up to the states. They gave several options as we open back up. And for those of you who are unaware, we'll in some fashion, we'll be opening up visitation, and there are some requirements around that based on COVID patients within the facility. But, I think the idea is you get a snapshot, right? So you get to understand where the facility's at, and it doesn't mean that it's going to stay that way, but it certainly gives you an idea of the barriers that you're having or any issues that you might need to work through. And then as far as testing, continual testing, we're currently working through a long-term care task force, which comes out of the cabinet, and they're going to be talking tomorrow, as a matter of fact, on what those recommendations are going to look like for the state of Kentucky. So hopefully we'll have some information by the end of this week to share. Well, let me say the beginning of next week, just given a shorter week. But I think we'll have some ideas of what that looks like. And one of the things that I've asked for is certainly don't want your loved ones to be poked and prodded unnecessarily. And so I've brought that up multiple times. I think it's really important that we test when appropriate, but don't just test for the sake of testing.
It's certainly not the most comfortable test, but I'm going to show you all a video here in a little while of just what one looks like for one of our staff members that volunteered, so you all can kind of get an eye. So okay, I know you've got a tight schedule, so I've got one last question.
Sure,
for
you're
you.
Fine.
The burning question, as you probably know, you already probably know what I'm going to ask you, is this visitation guidelines. The cabinet came out on Friday with a glimmer of hope, I know, for our families, but at the same time, also a little concern that are we doing this too soon? Tell me what visitation, what do you think that's going to look like in these facilities as we move forward?
Yeah, so it's certainly going to be modified. And I think you have to weigh in, health and well-being of your residents, along with their mental health, and certainly how the families are dealing with it. And so, it's been a significant amount of time. And I think if we waited till there were no COVID cases in the United States, we'd be waiting a very long time until we had a vaccine. And so we made the decision, right or wrong, we're just trying to make the best decisions possible. That if we can do it in a somewhat safe manner and mitigate as much risk as possible, that we think that given our numbers, we think that now is an okay time to start with visitation. And those of you that have looked at the guidelines, they're significant guidelines. I mean, they require a lot of probably additional staff from the facility, certainly delegated areas within the facility to provide the visitation setting so that people aren't walking through the facility and potentially infecting others. And I would highly recommend that all of you that are going to visit your loved ones in the facility, go ahead and get a COVID test and get the results back before you do that. Because the last thing you want to do is that, since you haven't seen your loved one in months, is bring something into the facility unnecessarily. So I think we have a task force. We've got I think maybe 8 physicians on there. We've got a representative from the AARP. We've got an ethicist. We have a gerontologist, and so palliative care physician. So I think we've got a really well-rounded group of people, and they really thought through the process to make sure that we were doing what's right for your loved ones. And trust me, my hesitation is always that I worry about us doing things too early, but at the same time, I understand the mental health aspect of it as well. And so we kind of have to weigh those things out.
Wonderful. Well, I'll let you go unless there's anything else you want to add before I know you've got you said you just had a few minutes, so I appreciate you sharing that. Is there anything else you want to add?
Yeah, I think, just so you guys are aware, part of my charge in this office is that I want to make it very transparent, open, and accessible for anyone that wants to reach out to us. And so that is my charge. So if you don't feel that you're getting the service you need from us, please, you can reach out to me personally. I think it's critical that you have an open line of communication with our office. And I have a tremendous passion and love for the individuals that get to live in long-term care. And so it's really important to me that you guys have access to us and that we can help you if you're having issues.
Awesome. Thank you so much.
All right. You're very welcome. Right. Thank you, guys.
Thank you.
Appreciate it.
All right. Bye-bye. Have a great day.
You do the same.
Thank you. Okay, now we're going to get right to business because I have a lot of questions that hopefully we can answer. And if you'll notice, should be depending on where you are, but there is an option for a chat. If you have questions or need me to clarify anything that we've talked about, feel free to use that chat and I can look at it. And then, as I said, I'm going to hit the questions that we've received and then we'll go from there. So, obviously the burning question that I'm getting is, why are we testing so much at Sayre Christian Village, and what has kind of been the rationale and the process behind it? So I'd like to just kind of dial back and explain the sequence of events as they have taken place here over the last 30 days. We had our initial round of state testing on May 28th, and so that was the facility-wide testing that Mr. Mather was speaking about, that all facilities in the state were to undergo. That round of testing was conducted by the state lab that was contracted because those tests were funded by the state. That was through Gravity Diagnostics. We tested 335 residents and staff, all here at the healthcare center, and everybody in the house tested negative, which, as you all probably remember receiving the one calls and the updates and the text messages and the information we're sharing on our website and our COVID information line. That's kind of how we've tried to get the information to you. On June the 8th, we had a resident that left the facility, went out to the hospital. And so when an individual goes out to the hospital, the guidance that we're to follow is when they return, they are to receive a COVID test and be placed in isolation for a 14-day period. So that took place. That individual came back and was tested on June 9th. And on June 11th, we received information that that test came back positive. That test was actually conducted, and from here on forward, through using a lab, Solaris. Solaris is here they're here in Central Kentucky. They're actually in Nicholsville. We chose them because they are on the list of approved labs for us to use. They're right down the street, so it's easier for us to get the specimens to them and get the results back in a timely fashion. So when that resident tested positive, and we learned that information on June 11th, that is when we, for all intensive purposes, we had to pull the alarm because as you probably know, when this virus gets in a facility in a congregate setting such as ours, it literally can spread like wildfire. And so immediately we were on the phone with our officials, with the Fayette County Health Department, the Kentucky Department of Public Health with the state, the HIA team, which is the group of officials that the state has designated to oversee long-term care, and I forget one more entity, well, the Office of Inspector General, and our medical director. And so the way that this works is that each county, essentially, while we have regulatory oversight from CMS and OIG, as far as the public health goes, that is driven by your county health department. And what we've learned through all this, I'll tell you, I'm not a physician and I'm not a lab scientist, and I'm not a testing expert, but we've learned a lot with what we're working with. But at that time, the decision was made to make sure that if we had one resident that was positive, because this resident was in the general area, just to be totally transparent, they were located on Unit 2 of our facility. And so naturally, we wanted to make sure that we tested the whole, our medical director, because of other facilities that he had been in and testing for, made the decision to go ahead and test the whole house again. So we did that on June 12th. And on June 12th, we, again, we used Solaris Lab. Oddly enough, the resident that tested positive the day before, she tested negative. And so we were scratching our heads. But then subsequently, 4 additional residents tested positive. So at that time, we didn't know, we didn't have all the answers, but what we knew is we had an outbreak according to CMS guidelines. And so we received all the results from the residents back before we received all the employees back. So we assumed that we had COVID in the building and that it had to come in from a staff member. And as you know, what's going on in Central Kentucky, as we're reopening, it's really not a matter of if, it's a matter of when. We are asking our staff to do lots of things and make lots of sacrifices. But the reality is, at some point, somebody's going to have contact with somebody who had COVID. So from that round of testing, as I said, there were 4 residents who tested positive. So essentially, the way that this works is until you have negative all the way around for a certain period of time, Fayette County requires us to do testing every 3 to 7 days. 3 days for us would be brutal because the amount of time that goes into this is just, and resources, and my staff and my team, they've done an excellent job. But there are only so many hours in the day for us to get this done. So the decision was made to, because we were still waiting on employee results at that point, to then go test again on June 16th. So we tested on June 16th and the whole house tested negative again. And we're scratching our heads now because these 5 residents had at this point at least 2 subsequent negative tests, which meant if they had the virus, they had recovered. And public health officials will say, you can have the virus, but everybody else that's exposed still has about a 14-day period where they might start showing symptoms. That's why we do this continuous testing. So we were happy on June 16th. We thought 1 more week and we'll kind of be off the radar for as the public health will have to stop having these daily calls with everybody and their brother and explaining what we're doing and how testing is going, etc. we had our next round, which what we thought would be our final round for at least this episode, on June 23rd, again using Solaris Lab. And we did facility-wide testing, and all the residents came back negative. We still have one resident that we're waiting on, but we don't expect that person to be positive. I'll explain kind of some issues we've had with the lab here in a moment. But we, on Tuesday night, about 11 o'clock on Tuesday night, we received notification that 5 of our staff members tested positive. So here we go again, sound the alarm, do all the notifications, make sure that those folks weren't in the building. We did contact tracing to see who they had been around, what units they worked, what departments they worked in, if they had been exposed to anybody with COVID. And we kept coming up with, no, I haven't, no, I've not been around anybody, no, I haven't, no, I haven't. And so I pleaded and pleaded and pleaded with our local health officials to let us do one more test to essentially prove or just confirm if it was truly positive or if we were redoing what had happened previously. Unfortunately, CMS guidelines and some other rules that we have to follow did not allow us to do that. We had to go ahead and make that communication. And our goal throughout this has been to be totally transparent. And so we wouldn't really have been being that way if we waited that time. So that's when you receive the call that 5 staff members have tested positive. Those 5 staff members, none of these folks had shown any symptoms. Again, had been exposed, had been any, I was kind of scratching my head. So we had them retested. And I'll be goodness, the next day they test negative as well. And so the health department says, well, you have to have 2 negative tests before it's truly negative. Okay, fine. So we wait, and you have to understand that the waiting for us is the absolute worst part. I'd rather be swabbed for COVID 10 times than have to wait 24 hours and know what these results are, because it really determines how we move forward as an organization. So when those staff members tested positive on June 23rd, negative on June 24th, and negative on June 25th, you all probably heard me or saw the steam coming out of my ears, because it just doesn't make sense to me. Again, I'm not a physician, I'm not a scientist, but common sense says there's something going on with this testing process. So I spent the bulk of the day last Thursday on the phone with anybody that would listen, Mr. Mather, the Long-Term Care Task Force, our association, Fayette County Health Department, our lab, our medical director, anybody that would listen, to say, can we please just agree that these might be false positives? Well, in the world of public health, you're not going to see people agree that there's a false positive, because there's really not. They'll say there's more of a chance to have a false negative than there is a false positive, the way that these tests are done. So we have to just treat it as if it is. And so that's why today we are doing another round of testing. And we have, based on my conversation with Mr. Mather, we are now using another lab. We're actually going back to Gravity Lab, which is the first lab that we used for all the statewide testing. Gravity Lab was intended to be the contracted lab to do the state mandated testing that first round, and then everybody else was kind of on their own to pick a lab off the approved list. So we just haven't had the level of satisfaction, and I'm not naive to know that it's really not a matter of if, but when we get a case on our campus. But in these situations, I just strongly feel that that wasn't the case. In all 10 situations, these residents and or staff had another COVID screen within a really close time from when they tested positive. So if you see negative, positive, negative, negative in a week's time, something isn't adding up. And I don't have that answer of what that is. I just know that going forward, we're going to hope that we'll have this lab that we're using. The results will take us a little bit longer to get them, and I'm okay with waiting so long as I have a better comfort level knowing that they are accurate. So that's kind of where we have, where we've been so far. And so some of the questions that have come out of that is obviously if somebody is, positive one day, can they be negative the next and vice versa? And absolutely. It depends on where you are in this process. It's just like with the flu. You may not have the flu today, but you might tomorrow, and then you'll recover from it. So there's just a lot of unknowns of what this virus, how long it hangs on, or you shed the virus, how long you're positive if you're positive. One of the things that, and this was one of the questions that came out, is there's actually two different kinds of testing that is being done right now. There's one that's called a PCR testing. You're going to ask me what that means, and that's where I need my lab person or my science person. I'm just working on the information that we receive. And then there's one that's an antibody testing. The PCR testing is detects if you're currently infected with the virus. So it would be like a flu test if you think about it. And I'll show you a video in just a moment, but we test using these nasopharyngeal swabs. And essentially what they do is they'll test in the back of your throat. It's like a strep test. And then in each nostril, and it's like a flu test. That's the PCR. Again, with our facility being regulated by CMS and the Office of Inspector General, we have to perform the PCR tests. We can't do the antigen testing, and we can't do the antibody testing to determine if the virus is currently present. So that PCR is what you'll hear. You'll hear of folks going to an urgent treatment center and they get their results right away. There are these rapid screens. Those are not approved screens for us to use. We have to do the PCR testing in our facility. So the other type of testing is the antibody testing. You'll hear that it's called an IgG. And what the antibody test does is it actually shows if you've had the virus. So in these 5 residents that tested positive a couple of weeks ago, they've actually already received 1 antibody test. The antibodies, you don't actually start to build those until about 1 to 3 weeks after you've shed and tested negative for the virus, okay? So you're not going to be getting a PCR test and an antibody test at the same time. That's not going to tell you what you want. So you're going to get your PCR test. If it shows positive, you'll continue to test until you're negative. Once you're negative, you'll wait about 1 to 3 weeks. That's when you would get an antibody test, and it'll show you if you've ever had the virus. So again, those are not appropriate or acceptable forms of testing. We only use the PCR testing. I'm going to show you this video. If you'll hang on one moment, I got to figure out how to do this. Here we go. So let me push play on this. So as you see, and it's silent. You're not hearing any music behind it, but this is our staff. And we use, when we're talking about testing, our medical director, when we have a testing day, he and his team, they bring in 6 individuals. Here she is. That's going in the back of her throat. That's like a strep test. And we wait, and you'll see, yep, are you ready to go? And she's going to go in one nostril. And she's going to swab it around a couple times. That's the one where you hear, did they get your brain or your eyes? It's really not, it's a jolt, but it's uncomfortable, but it's not to the point where it'll flip you over in your chair. And so they'll go in both nostrils. They're going to put it back in the vial, and that's it. So I know a lot of you are their questions are, how does mom or how does dad tolerate, see, she's smiling, obviously that wasn't too bad, but how does mom or dad tolerate this test? And so then the sample goes in a vial, and we package it up, and then that vial is sent off to the lab. So that's kind of the gist of what our test looks like. So when we test in our testing day for us looks like we start at usually 5 a.m. in the morning, and we finish at 7 p.m. at night. And what happens is Dr. Richard and his team, they bring in, usually there's about 6 of them. They come in, they swab all the residents. And then they also swab the bulk of the staff. So this morning, for example, between 5:30 and 9:30 a.m., we tested 270 individuals. That's all 120 residents and about 150, excuse me, of our employees. And so then we'll spend the rest of the day capturing folks, our employees, as they come for their shift or as they're leaving from their shift. And we have a designated team of individuals on our staff that have been trained by Dr. Richard on how to do the COVID screen. So that's kind of what the actual test looks like. Once we go through our day of testing, then we package up all of those specimens and we deliver them to the lab. Today we already had a courier take the 200 and I believe 50 of them that were done this morning onto the lab, and they're in the process of resulting those as we speak. So that's kind of how that works. Another question is, why do you go in the throat and the nose? That seems disgusting, but that's the guidelines that that these tests are. That comes from the lab as to how to get the best specimen. And if you think about it, I'd rather you go in my throat first before you go in my nose. If it's the other way, then that's kind of gross, right? So, but it's so that you can get a good sample. You don't want to have a false negative because you didn't get a good sample or the sample wasn't appropriate. Let's see. I'm going to start going through these questions. We have answered those. Are all of the providers or resources mandated by the state? Yes. We have a designated list of labs and tests that we are supposed to use to make sure that we're consistently and we're getting the best samples that we can. So why was the initial patient's test positive? We don't know that. We do know that, as I said, they went out to the hospital. They were at UK Hospital, which is kind of the breeding center for COVID right now. We don't know what that was. We don't know if it was a true positive or not, but we have to go on the results that we're given and act appropriately. The last thing that I'm going to do is ignore a positive because we're just not going to put ourselves in the position where we're not responding quickly to make sure. In that case, when those residents tested positive, we found that information out, I believe it was about 7 o'clock on a Friday night, and we were here till midnight cohorting, making sure that we were removing those folks from all the rest of the general areas so that if they were truly positive, that we weren't putting anybody else at risk. We're putting on complete PPE, which includes an N95 face mask. All staff have been fit tested, which means made sure that their N95 mask is being fitted appropriately. Eye protection, gowns. We look like a bunch of Ghostbusters walking around here when we're in full PPE, but necessary to keep our staff safe as well as prevent any spread of COVID within the building. We do have a designated area. For those of you that are familiar with our building, it's our cohort area is our palliative care suites. It's if you've been around the building for a long time, it's the old entrance to the building. There's a separate area in there that is totally segmented off. It has its own entrance. Everybody comes in that we have a specialized team of people that they're working in that unit and nowhere else in the event we are taking care of COVID folks. And we had to submit all of these plans to the state for approval before we even did our first round of mass testing to make sure in the event we did receive 76% of facilities are getting positives out of that initial round. So you have to make sure that we were ready in the event that we did. Okay. I'm just looking for some other questions. We did receive a lot. Okay. Let me get my notes. You're not supposed to be doing that. Don't tell anybody. I just licked my finger to turn my page, but my fingers are fingers. So as far as the burning question we're getting is, okay, when it's time for us to come back, should I be tested? I'm going to say yes. Yeah, if it was me, as peace of mind, I would want to know if I'm walking into the building that at that point in time I'm negative. And for that purpose, those antigen screens are appropriate, but they are not going to be appropriate for our staff or our residents to use, because they do see a higher false negative in those. But we'll make sure that all of our visitors, once we get to that point, that they're screened, that they're asked a series of questions, just like we do with all of our staff and anybody else that comes in the building right now, our lab techs, our pharmacy, anybody that's in the building, we're treating them as if we don't know what they're coming in with. We've talked about the 2 different tests. Can somebody test negative and later test positive on a viral test? Absolutely. This is like Mr. Mather said earlier, it's a snapshot in time. So a lot of the questions we're getting is, well, I had a test on May 28th. Why do I have to take another one? Well, because a lot has happened between May 28th and now, and about half of the people that are tested and are positive are asymptomatic. So we got to make sure that we detect that, because we don't want to have our staff or another resident, for instance, be that honeybee, which is pollinating the whole building and us not being aware of it. Let's see. I'm going to start answering these questions on this chat here in just a moment. We've talked about the antibody testing. If I've recovered from COVID-19, will I be immune? You know, there's so much to know about this virus yet that we don't know. They're still trying to determine what these antibodies, what immunity will look like. And, you know, I think one of the things that's been a challenge is it has been a moving target, and we've learned so much about it as this thing has evolved. So we follow the CDC guidelines, as well as guidelines from the FDA. I look at the Johns Hopkins. I'm there all the time. Of course, CMS, that's kind of our overarching regulatory device, and they tend to take a stronger approach on these guidelines because of the vulnerability of our population and us being in congregate settings. Just did it again, sorry. So what steps are you supposed to take before reopening to visitors? The burning question right now is that on Friday there was guidance that came out for long-term care facilities about reduction of restrictions. Specifically, there's about 4 components to it. The first is communal dining activities, off-site transportation to appointments, and then lastly, having visitors. And so with us being a skilled nursing facility, those guidelines are very specific. For example, the July 15th date that you see, part of that requirement for the July 15th date is that you will have no known or positive cases in the 28 days prior to that. So unfortunately, our clock has not, we won't meet that 28-day guideline on July 15th because of our most recent testing that took place on July 23rd. So today we'll see what the results come back from today, and hopefully that will be the start of our 28-day clock, if you will. There's a lot of things that we'll have to do before these visitations can take place as well. We have to submit a plan to the state that shows all of the things that we're going to do to make sure that we mitigate or minimize the risk of COVID in the building. There's some other guidelines, you can't have staffing shortages, and I will say that you all should rest easy at night. I cannot tell you how proud I am of the staff. They have stepped up and done things that are uncomfortable and are completely inconvenient. They've picked up shifts and stayed over the night that we were here and had everybody in the when we cohorted residents. My biggest concern is that we're not going to have anybody to staff this because the staff are afraid. There's a lot of anxiety, what they're seeing and hearing in the media. And that was the first problem that we solved, was how we were going to staff that area. So we had staff stepping up and doing things that, to be honest, you or I probably would struggle with. But they have been called to provide, or they've been called to be healthcare providers, and they've done a great job doing that. How often should a nursing home test its residents? As I said, it looks like until we can show that we've not had any new cases, we will have to do it on a regular weekly basis. Once we show that we haven't had any cases for a given period of time, then what will happen is that it looks like the staff will undergo weekly testing, and the resident testing has not been, those guidelines have not been finalized yet, because to Mr. Mather's point earlier, there comes a point where how many of these do we have to do and how many times, because it isn't comfortable. But obviously, anytime somebody has any symptoms, we monitor we do respiratory assessments on all of our residents here. We're monitoring them 3 times a day. The first sign of COVID is, for us in our environment, is an elevated temperature, shortness of breath, some respiratory symptoms. So we're looking at those first and on a very regular basis. So in the event that we had somebody that was exhibiting any kinds of signs and symptoms, we would test them, place them in isolation. Same thing as we're doing on any new admissions or anybody that comes back. We are isolating them and putting them and having a COVID screen on them, just to be sure that we don't have any areas to be concerned about. All right, most of these I have already covered. Let me just look at my notes, and then I will answer the questions and comments. I think we're in pretty good shape. The CDC has a lot of great guidance, and so does CMS, and we've been we'll start posting some of those links on our website so that when you go to look for our COVID update, you can look there. So I've answered all the questions that were submitted. I'm going to go over here and see what's in the chat and see what we can answer so far. Oh gosh, there's a ton of them in here. Hang on. You guys have been so conscientious and tireless throughout this whole ordeal. Thank you. Well done. Oh, thank you. That I can't tell you how much your support is the fuel to our tanks every single day. We've been working really, really hard. So thank you for all of those. Okay, are hospitalized patients required to have 2 negative tests before returning to LTC? So yes and no. A hospital, before somebody is discharged into a long-term care facility, they have to have a negative screen within 48 hours of admission. A lot of these hospitals, their protocol has been to do a COVID test on discharge. Our protocol, not knowing, sometimes we may not get the medical record right away and we're on a time crunch for admission. We go ahead and do a COVID screen on admission. And then we do another one on 13 days after admission, because you're thinking a quarantine of a 14-day period. So on that 13th day, we do another one so that we know they're negative before we remove them from isolation and put them in with whether it's a roommate or another area of the building. Will visitors have to show proof of negative tests before entering building? We're not sure yet on that particular guidance. One of the things, I was on a call earlier today with the Kentucky Department of Public Health and a lot of the long-term care facilities. One of the things that a lot of these facilities are doing is they are concerned that it may be too soon to start visitations. And so the guidance allows us, talks about the minimum things that we have to do. But there are some facilities that are taking a more strict approach, and you may see some that make that requirement. We have not had a whole lot of time to look at this guidance yet for the long-term care facility, because the guidance also includes open visitation for assisted living facilities, which we've got one, Friendship Towers, on our campus, and that guidance allows for visitation starting today. So my focus today, in addition to testing, is becoming familiar with this guidance as it relates to Friendship Towers. So we've not made a call yet, but I do expect that our visitors are they're going to wear masks. They're going to have a screening. They're going to make sure that we, again, take every precaution. We've worked really, really hard over the last 4 months, and my concern is that if we just kind of Katie bar the door, it might open us up to risks that we're not quite ready for. My dad is at a different senior community, not at Sayre. He said he got a shot and then the site was inspected. Is that a valid COVID test for a senior community? If he got a shot, they're drawing blood, and my guess is that is an antibody screen to see if he had it. The Pcr testing that's done and the antigen testing that's done is all done, whether it's an oral, a naso, or a combination of the two swab. Another, what's the time frame for testing upon visitation? We've just not made that call yet. Testing for frequent visitors doesn't seem practical. I agree. But we would probably do, we will screen everybody. Have you been in contact with anybody? Have you been in any of these hot spots? We will do a temperature. We've ordered a kind of an infrared thermal scanner that has got facial recognition, so that when visitors do come in, that it keeps 30,000 faces or something, but it'll recognize your face, it'll take your temperature, and it'll make an audible alarm of whether or not there's a temperature. And then you'll have to answer a series of questions as well. We'll have a designated area for visitors that I can imagine. It's going to look a little bit different than it certainly did 4 months ago, but encouraging from what it is today. Earliest visitation will be end of July, not July 15th. Is this correct? Yes. We'll need to see what the results of today's testing does before we see where our clock is for that 28-day period. Window visits, again, we hope window visits are going to resume very soon. We're going to see what this round of testing brings us, and then we'll get guidance from Fayette County Health Department on, we will most likely, they're going to have us test again next week if I had to just place my money on it. But right now what the Fayette County Health Department has done is they have, based on where these 5 positive employees worked, they have essentially marked the building in areas of zones. So if anybody is in a green zone, that means it wasn't on their unit. And just to be transparent, for example, unit 3 is a green zone. Nobody that has tested positive either lives or works or has been on unit 3. Units 1, 2, and 4, that's not the case. And so while there's no current positive cases over there, those folks are at risk because they do believe they could have been in contact with these employees that, whether we agree or not, they did test positive. So those folks are in that yellow zone. They're asking them to kind of stay hunkered down in their areas and not travel around the building. We can't do the window visits without having folks travel around the building. So we hope to bring them back very, very soon. I know Tyler is missing seeing you all. We are so blessed. Thank you. We have stepped up. You all have done an awesome job. Thank you. Praying Psalm 91 over the staff and residents. Oh, y'all are going to make me emotional. Do you anticipate requiring a quarantine? Not if that's for visitors. Again, we're not quite sure what that's going to look like. We're still combing through this guidelines. Thank you. Staff has gone above the call of duty. I have to read these because they help me feel good. Front office has done an outstanding job leading through this. Guys, this testing takes an army of people. And we're in here from the testing day is, for me, it's 5 a.m. in the morning till 11 p.m. at night when we're starting to look at results. So, and that's just not me. There's a whole bunch of, we got a great leadership team. They're doing a great job. When will we know results from today's testing? So again, folks that were tested before 10 o'clock this morning, they all have been delivered at the lab, and they ask for about 48-hour turnaround time. Again, we're going to have a little more of a lag, so you won't be receiving a call from me today as what the results are. Look for that starting tomorrow and Wednesday. Okay, that is all of the questions. Look, we're right at 4 o'clock. I will, if we've answered your questions, you're free to drop off. If you still have questions, I will unmute the line. Just do know that we have recorded this session, and we'll post a link to it out on our website. If you have family or friends that maybe didn't have the opportunity to catch it, and if there's anything we didn't share, certainly reach out to us. The hope@sayre.us is a great way to do that via email. Of course, you know how to, our COVID information line. And if you're not receiving my texts or the annoying calls I send, I'm sorry that they get lengthy, but if you're not receiving those, that is the best and quickest way for us to get the information to you. So I will, like I said, if you're finished and have a tight schedule and want to move on, feel free to drop off. Otherwise, I'll unmute everybody and take questions. Nobody speak at once. You gotta, oh, hold on. I guess I said I can unmute everybody. I see you trying to talk, Miss Glenda. I've got Ann Reed on here. She's our administrator. Ann, did you want to say anything before we go?
Hold on, let me see if I can unmute myself. Am I talking?
You are. I hear you. I don't see you, but I hear you. There you are.
Hey, everybody. Just wanted to tell you, I know it's been rough not seeing your loved ones. It's been rough for us as well. We just want to take care of them, and we appreciate the confidence that you've had in us here. And we're here for you if you need us. I'm here for you if you need me too. Thank you all so much for joining us today.
Thank you for having us. Can you hear me now?
I can hear you.
Oh, okay. This is helpful. I'm glad. Thank you. Thank you so much for having this. This was good.
Well, good. I know that a lot of times the information we're sharing, you're getting it one way, and there's certainly so many questions that we have questions. So I know if we have them, you do too. So don't ever hesitate. Like Ann said, reach out to her, myself. If we don't have an answer, we'll get one for you. But we just appreciate your patience and your support. I think we'll be on channel 36 tonight. We've had a lot of earned media over the last couple of days, but channel 36 will be on Spectrum. We were on WKYT and Fox last night, and channel 18 on Friday night. So we've been all over the place, but our goal has been transparent and open communication with you all as much as we can throughout this process.
Karen, does the facility have to pay for all those tests?
Oh, that's a great question.
That's a lot of money.
So you all know we're the only nonprofit facility in Fayette County. The first round of testing was funded by the state. The subsequent rounds of testing, there is a waiver that and folks that have insurance can bill the insurance. So our residents, for the most part, will bill that insurance. If we don't have the insurance on file, or we have, in this case, mostly employees, that don't have insurance, then we do get the bill for those tests. And they're not cheap, about $50
no.
a pop.
Oh,
And we've done about, I believe, I don't know, well, at this point, close to 1,800 tests in the
oh
last
my
month.
goodness. Oh dear.
So I'll be calling on you to help us do some fundraising.
Okay. All righty. Whatever.
That's why we do our birthday fundraisers, to pay for COVID tests.
Yeah. Mm.
That's a great question, though.
Well, I'm going to go. Thanks again.
Okay.
Bye.
Bye-bye. Good to see you, Glenda.
You too, Karen. Hi, Scott. Can he hear? Well, if I can figure out how to get out of here, I might. Oh, leave. Bye.
Okay. Well, as always, you all know how to get a hold of us. And if there's anything we can do, never hesitate to ask a question. I would hate for you to not know an answer and lose sleep over it. There's just so many unknowns about this. So we're doing the best we can. I can tell you that. And our staff, they just, oh my gosh, say a prayer for them. They are the true rock stars. They have, and our residents, they are just, they've done a great job too. Okay. All right. No more questions. We're all finished. We were pretty close, 6 minutes over.